Hello, and thank you for joining us in this little video clip that we're putting together. We really wanted to join you at the Out of Darkness Walk. However, as you know, with COVID, that has been canceled for safety reasons, and so we are joining you today through video. My name is Carolyn Meske. I am the clinic manager in the Fargo Office of Solutions Behavioral Healthcare Professionals. My partner here, Danette, as you can see, we are distancing. Do you want to introduce yourself real quick?
Sure, I'm Danette Merriman. I'm the clinic manager in the Moorhead office.
Thank you. And so we wanted to just share a few tidbits on what services we provide both in Fargo and Moorhead area and outlying areas. And as I said, we were hoping we'd be able to talk with you all in person at the walk, but since we can't, we're hoping this information will be helpful to you. And we'd invite you to reach out with any questions. We will also be attaching some electronic brochures, I guess, if you will, with some of our services, and that may help answer some questions as well. So, as I said, we're Solutions Behavioral Healthcare Professionals. We have been in operation since 1999 in Moorhead. Fargo joined sometime after that. On both sides of the river, we have a number of services that span across the lifetime, I guess. I would say families, individuals, couples. Danette is going to explain some a little bit more in detail to you, but I wanted to just kind of let you know what we had at this point. And again, thank you for joining us. So Danette, I'm going to turn it over to you if you want to just explain a little bit of the services we have.
So as Carolyn alluded to, we have a variety of services that span the whole lifetime. So we have services for even babies where we help parents be able to attach with their child in a way that is really helping and conducive to attachment, all the way up to working with people that are working through end of life issues. And so for our child services, we work with kiddos that have all kinds of different disorders. They may struggle with depression or anxiety, maybe some behavioral things that are going on in the family or at school. Also, we work a lot with kiddos who have trauma, who also have suicidal ideation, unfortunately. And we work very closely with the family. We really believe that the family is a vehicle to change. So we do provide, like I said, a full gambit of services that we do an assessment, and then we base our recommendations off that assessment as to what type of service will best meet the needs of our clients. Our adult services, we do much the same, where we do an assessment, and then we have lots of different programs and services and providers. We try to make sure that we have the right match of provider, and then also the right match of treatment. Solutions believes that we are privileged in mission, and so we're very blessed to be able to offer this support to people that are struggling and wanting to change things in their life. And we also believe that we want to be leaders in practice, which means that we want to have evidence-informed practices that we are providing for folks. We have psychologists on board, so we're able to provide testing and really be able to get an accurate diagnosis. And also we have LMFTs, LPCCs, and LICSWs, and so we have just a myriad of services to hopefully be able to provide for anyone who is needing services. Something a little bit new in the last few years is behavioral services that we're offering, and we do that on both sides of the river. And that's been really exciting because it's really helped to keep kiddos in the home and really help parents, increase their toolbox so that they're able to, provide, different tools or different strategies to their child and able to have a home that's a little bit more harmonious. I'll turn it back to Carolyn.
Yeah, agreed. And so as Danette said, we provide services kind of through all environments. And so you will see us providing services within schools, both sides of the river again, in homes, daycares, on site. So a number of places with the intent again to really solidify the positive changes for that child and family. And so I agree with Danette. We've been really blessed to be involved and be able to provide these services. And I tell you, it's rewarding to watch people have things turned around. One of the other services we do on the North Dakota side is we are involved in the mobile crisis. And so our team is often dispatched out after hours to a crisis in wherever it's necessary on the North Dakota side. And so that is something that's been very beneficial, and we've we felt really strongly about that piece being well known to people, especially when it comes to suicide. And so we contract under the state of North Dakota with Southeast Human Service Center to be the after hours provider. So we are essentially out on these calls evenings, weekends, when Southeast is not open. And so we're covering those cases. And so again, that's information we will be happy to attach to this so that you know where to contact us for any questions, anything else that you may have. Just to kind of wrap up, we also wanted to mention to you, as you know, COVID is raging right now, and so we have taken every step we can following CDC guidelines with our agency, and so we have those posted on our website in each of our offices, and we walk through those plans with each of our clients so they understand the safety precautions that are expected both on our end and the client's end, with the intent of keeping people safe and well. So even right now, as you can see, you know, we're distancing, but we are offering services, a lot of services through telehealth right now, which has been a huge benefit, I think, and has allowed some folks who maybe would not have received the service otherwise, have started to receive it and have done really well with it. So our clinicians are very skilled at using that tool. It's been a great benefit. And I think that will continue for some time. We actually did telehealth prior to COVID as well, so we were ready, which is good. We are also doing some services on site. Behavioral services are really tough to do through telehealth, and so we have additional precautions for those services to make sure everybody is able to do okay and be safe, you know, with that kind of service. And then we're starting to do some outpatient services on site again too. But again, a lot of precautions around that, a lot of expectations we have both with our staff and with the client to make sure everybody is safe and well. So that is our service. We hope that you would reach out either to Danette or myself if you have any further questions. And you can reach either the Fargo-Moorhead office. If you call one and can't reach it, they'll flip you to the other. But again, we'll put that data in attachments to this video. Thank you for watching.
Thank you.